Hello, my name is Julie Pope. I'm doing my informative speech on Medicare reform. This is Sheena. She's my daughter. She's doing the recording.
Hi.
This is Thomas. He's a nurse from the hospital.
Hello.
And this is Jaleesa. She's an RN from the hospital also.
Hello.
We're going to start by defining what Medicare is. Medicare is a national social insurance program instituted by the U.S. federal government in 1966. It utilizes 30 private insurance companies to provide health care for Americans 65 years and older who have been employed and paid into the Medicare system. Younger recipients are eligible that have disabilities, end-stage renal disease, amyotrophic lateral sclerosis. Medicare covers half of the charges of the health care cost. The enrollee covers the other cost either by out-of-pocket payments or through supplemental insurance. Medicare reimbursement cuts took effect January the 13th, 2013. Additional cuts were April of 2013. These cuts decreased the operating margins of physicians and hospitals. Private practices experience more of the financial burden than other Medicare providers. It is predicted that most private insurance will follow suit and follow the Medicare reimbursement cuts. The ripple effect could be that many patients may receive unnecessary and expensive procedures that proper pre-testing could eliminate, and that's from the American Association of Neuromuscular and Electrodiagnostic Medicine. I will discuss how Medicare cuts affect testing, ordered services, and patient financial liability in the healthcare organization. As you can see per this chart, currently Medicare covers most of the cost. By the year 2022, it's expected that more out-of-pocket expenses will be paid by the patient. And who am I to talk about this? I'm an RN that works at a not-for-profit hospital whose main clientele is Medicare recipients. Medicare guidelines set the standards for insurance-approved procedures and reimbursements. My primary job is working in pre- and post-surgery screenings to make sure that the patient's order matches the service that the insurance will pay for. Why is this important? It's important to have the correct order in order to obtain reimbursement from Medicare. Medicare cuts by the federal government affect the type of testing, procedure, and care a physician can order for patients by limiting approval and reimbursement by Medicare. Medicare cuts limit approval and reimbursements for certain tests. Benefits paid to physicians will decrease by 21%. Strict billing for procedures has been implemented. This has been discussed since the Clinton administration. It's estimated that $155 billion will be cut from Medicare over the next 10 years. With these cuts, physicians and hospitals have to be more conscientious about the tests ordered on patients, and that's from Senior Corps 2015. Medicare cuts limit approval and reimbursement for certain physician-ordered services. Each physician and nurse practitioner must have an individual national provider identifier, not an organization, or it will not be accepted. As of January the 6th, 2014, CMS requires all claims submitted for lab tests, imaging procedures, durable medical equipment, prosthetic orthotic supplies, and Part A, home health aids, to be declined without a valid MPI, and that's from the Centers for Medicare and Medicaid Services. Medicare cuts increase the patient financial liability by increasing out-of-pocket costs. From 2012 to 2017, Part B premiums and deductibles will increase significantly. Seniors will need to purchase private supplemental insurance or face huge financial costs. In 2013, the federal budget proposal, Medicare Part B and Part D premiums will increase by 15%, and that's from the Heritage Foundation in 2015. In conclusion, Medicare is a national insurance program instituted by the U.S. federal government to provide health insurance to individuals 65 years and older and younger patients with certain disabilities. Due to Medicare cutbacks, some tests, procedures, and services are no longer deemed appropriate. These cuts increase the patient out-of-pocket expenses. And that's important because Medicare is one of the driving forces that determines approved healthcare tests, services, and reimbursements to physicians and hospitals. As consumers in our community, it is up to us to make well-informed and wise decisions regarding our future healthcare system. Thank you.